观众朋友，大家好，欢迎收看本期的最佳方案。提起牙病，有这样一句俗话，叫“牙疼不是病，疼起来要人命”。其实很多牙病在初期的时候是没有太多疼痛的。牙病要是疼到要人命的时候，那么其实已经就很晚了。那么我们到底该怎么来看待这个牙病，又怎么样寻找一个好的医生呢？本期节目呢，我们采访了毕业于哈佛医学院、已经有着20年经验的资深医师 Joseph 宋，我们来听听宋医师的讲解。
Hi, how are you? It's good to be here. My name is Joseph Song. I'm a periodontist. I went to Columbia and Harvard Dental School. And a periodontist is a dentist with a special education in treating periodontal disease, which is gum disease, and a dental implant. My main office is located in downtown Flushing. Why people become orthodontists? And when I went to dental school, and then which is 20-something years ago, I was in the lecture, and then one of the professors showed us about dental implant. And as soon as I saw the dental implants, I knew it will be a future. So I jumped into the periodontics, and then I studied the periodontics and become a periodontist. I love what I'm doing, and then I'm happy I got into the position that I can help other people too. It's like a community service. I want to make my practice more affordable and still maintain a good quality, and there's more people can have a very good quality modern dentistry. Do you have a bad breath? Are your gums bleed when you brush or floss? Your gum is red, swollen, and is tender when you touch it? Or you have a loose teeth? That's the signs of gum disease. The gum disease is the chronic inflammation mainly caused by bacterial infection. About 80% of the population, adult population, has some form of gum disease. It's an inflammation around the teeth, the gums, and the surrounding bones. If untreated, you're going to lose your bone supporting or holding your teeth, and eventually end up losing your natural teeth. When you take a look at your teeth, there are little spaces between your gum and the teeth. This space is called sulcus. You're supposed to keep this area clean with brush and floss. If you don't brush it, you will have a plaque buildup. Plaque has a bacteria, and it produces the toxin. The bacteria that produces the toxin combined with your body's response and are responsible for chronic inflammation, which is the gum disease. You have all the symptoms and signs, like bleeding gums, swollen gums, red gums, bad breath, but until it becomes very late in stage, you don't have a pain. If you don't have a pain, most of the patient doesn't see the dentist, and then they wait until unsavable. Okay, this is a before and after picture of the patient with the gum disease. Take a look at this red and swollen gums, and then you can see a lot of plaque and tartar buildup. And this is a picture after the laser gum surgery, and then you removed all the plaque and tartar, and then your gum become healthy again because you don't see any swollen and red and bleeding gums. This is what healthy gums supposed to look like. Like I said, I explained all about the gum disease, what's the gum disease and how to treat it, and then your best thing or the right thing is try to prevent the disease from happening, and once you have a disease, try to catch it as early as possible. And then nowadays, there's many techniques like a laser gum surgery, which is very minimally invasive. It's not much painful. One of the things why people are afraid to go to the dental office is the pain. Okay, but there's a wonderful technology out there which is very less invasive than before. And once you lose your natural teeth, and you have to replace it, and then what I'm saying is dental implant has become a standard of care for many cases. You do gum surgery and try to remove the inflamed gum tissue, and then those gum surgeries are supposed to stop the progression of the disease. There are two different types of gum surgeries, and one is a conventional ones. And the conventional gum surgery uses the scalpel and suture. With the scalpel, which is a knife, you cut open the gums and you clean out everything, and then you close everything back with a suture. And because of you use the scalpel and suturing, it's a more invasive procedure, meaning you have more pain. On the other hand, laser gum surgery, and then the type of laser machine I use is called periolaser. Periolaser is a soft tissue laser machine that is specially designed for the periodontal surgery, which is a gum surgery. It uses the specific wavelengths of the laser, which vaporize the inflamed gum tissue only, and it's combined with the ultrasonics. It does the same thing as a conventional gum surgery. But because of no scalpel or no cutting or no suturing is involved, it's less pain, less bleeding, and it's less healing time. It's much less invasive procedure. The machine itself is very expensive. It's well over $100,000. But I've been doing this one. I've been doing laser surgeries for over 5-6 years already. And this, when I started laser gum surgery about 5-6 years ago, I was one of the very few dentists in New York who's certified to do the laser gum surgery. But nowadays, there are more and more dentists or periodontists doing a laser gum surgery. I use the periolaser. There are many different types of the laser, the machines for the gum surgery, but the name of the laser machine I use is a periolaser. It's especially designed for the gum surgeries. We first try to save the natural teeth as long as possible. And as a dentist, as a periodontist, that's the main goal of myself and my practice. But unfortunately, sometimes patient came in too late. I can't do anything about it. And then sometimes patient ends up losing their natural teeth. Once you use your natural teeth, you have to replace it. Otherwise, you're going to have a more problem later on. It's all about the quality of life. If you don't have a teeth, you cannot chew it, and you cannot speak properly, and you don't look good because you're missing teeth.
曾经有一些朋友就和我说，牙周病是没有办法治好的，所以我一直以来也这样是认为，牙周病治疗的意义并不大，反正也治不好。但是今天听了宋医师的介绍，使我对牙周病的认识又有了新的认识。当然，如果牙周病已经很重的时候，那么就要考虑拔牙和植牙了。那么在植牙当中，我们必须要注意哪些问题呢？我们接着请宋医师来给我们讲解。
And then dental implants has become a standard of care for many cases. You can either replace the single missing tooth, or you can replace the several teeth to make the bridges, or you can be used to fabricate the removable partial denture or even a full denture. For the last 20 years, I met a lot of people, a lot of patients who want to have an implant but couldn't afford it. And dental implants is not a difficult procedure for us anymore. It doesn't take a long time to finish it. I want to make my practice more affordable so more people, more patients can have access to the best quality of care. It is possible because we have many years of experience. We have a team of qualified dentists, dental implant manufacturing company, dental instrument company, and dental laboratories. As a team, we can make it possible. In terms of success rate, those 80 to 85% to 98%. Those high success rate paper was done by qualified specialists. compared to those 85% success rate, which is done by the general dentist or with less experienced dentist. If you do the dental implant with a more experienced dentist, you're gonna have a higher success rate. Just like let's say you're gonna have a brain surgery, all right? Or you're gonna have a baby, okay? I mean, are you gonna see any doctors? You're gonna go to the specialist, okay? The specialist who has a more education, and then who is more qualified, and who spend more time studying those specific field, and then who has a more time treating those type of patient. I don't do crowns, I don't do the root canal. I do implants and gum surgery. So that's what specialist is for. I love what I'm doing, and then I like to talk to the patient. I like to meet with the people, and I like to explain what I'm doing to the patients. And then one of the duty as a dentist is not just treating the patient, and I like to educate the patient about the dentistry, especially about gum disease and implant. And I enjoy talking to the patient. Yeah. And I really enjoy being a dentist. Thanks for inviting me here today. And dental implant has become a standard of care for many cases. But in my opinion, natural teeth are better. Try your best by brushing, flossing, and have a regular dental checkup, and try to keep your natural teeth as long as possible.
在采访中，宋医师一再告诉我们，选择专业的医生做植牙手术，这非常重要。因为经过专业训练的植牙医师呢，比一般的牙科医生成功率要高很多。医生选择对了，自身的治疗效果也就有了保障。好的，我们感谢宋医师为我们带来的知识，希望今天的节目能对大家有所帮助。观众朋友，我们下期节目再会。